As part of this public health issues class, one of the things that you're going to do is you're going to use case studies. You're going to work as a group on case studies. And some of you are always sort of asking me, why do I have to work with other people? Why do I have to do a case study? I'm going to give you an example of why that's so important in public health, because we work with people from different disciplines, and I'm going to use COVID-19 as an example. That's a case study. How did we find out about it? We found out about it from physicians, public health people who were talking about it online, an ophthalmologist most infamously, a new type of flu that we saw. It's spreading, it's dangerous, people are dying. So we found out from people who were on the ground providers, and then that ramped us up to public health. Then we saw the government's public health response, or not. We saw them building hospitals, we saw lots of people sick, we saw people put into a quarantine in one state, Wuhan, and they couldn't leave or couldn't go, hence the contagious nature of it. They wouldn't let the World Health Organization in, otherwise we'd have had more information about it. They wouldn't let the Center for Disease Control, CDC, in, otherwise we'd have had more information. We tracked, once we saw it showing up in other countries, we tracked where that went from and came from, and that would be people who are epidemiologists, contract tracers, who are looking at, if you were on a cruise ship and you went here, where else did you go? So that's one of the reasons why I have you learn about contract tracing, and it's a good job opportunity too during this pandemic. That connects us backwards to where the disease is coming from, who carried it where did these people go from the cruise ships? Unfortunately, some of them then went to Venice, and then some of them then went to London, and then some of them went to other places, Spain, in Europe. Then those people infected more people, and then those people came over to New York, and that's one of the ways it got here, is from New York. The people who came in from China, and how it got here from China, was in Washington State when we saw that happen. People who'd gone and visited relatives, then they came back to that part of the United States. All of that is through epidemiology and contact tracing, sort of saying, who do you know, who did you connect with, that's how it spread. So far we've talked about on-the-line providers, then we've talked about government responses, World Health Organization, CDC. For instance, the CDC asked for a copy of the gene so that they could sit there and sequence it. So those are biological scientists who are sequencing DNA so they can figure out how this virus works, what it does, how is it different from other viruses, how is it similar to other viruses. They can compare and contrast what they know. All of this information is being fed into what we know, and it's sort of this changeable, movable feast, but it's an ongoing case study with different actors talking across their disciplines to each other, trying to either contain it, and some people are trying to learn about it and give us more information. So when you do a case study in this class, you're going to get sort of the narrative, but then each component part, a question, is sort of a different actor addressing it, and you're applying different things of your concepts that you're learning in the class. So you might apply an epidemiological contact, you might find health communication part, you might find how do we make sure that this is not going to happen in the future, preventative. And you're going to find how do we do health in all components of life, so then we need more healthy food, those kinds of things, right? So each of your case study questions is sort of a different actor that's important in this case study. So now we come to the United States. It gets here, then we've got the CDC tracking it, right? Epidemiology people tracking it. We've got reports from hospitals that tell us about what's happening, how many people are coming in, how many people are testing positive, even though they came in for other things. They're reporting it back to the CDC. So again, you've got those frontline providers, different people than just seeing patients, but you've got the frontline providers. You've got them reporting to the CDC. Then they've also talked about treatments. What are the outcomes from treatments? How long are people in hospitals? Who's getting the sickest? What are the kinds of things they need? They're feeding all that information back to the health policy component of what kind of policies do we need in place? How is this spreading? Where is it impacting people? What should we do? So you've got that prevention, that containment, all of that is fed by different actors expanding and giving information back. So again, one of the reasons you are doing a case study and one of the reasons you're learning about that is because each of those cases is teaching you how to, in this class, work with people with different expertise. But that is exactly what you do in public health. It's not just about only dealing with providers, it's also getting sort of the basic science about something, and then how can we contain it or not. Then, the healthcare system is still feeding in that information, so it's a changeable kind of daily changeable approach. We know from epidemiology and long term that a vaccine is the best way to stop all of this because it's so contagious. Not as contagious as measles, which is about 99 to 95% contagious. This is not, believe it or not, as contagious as measles. But we know there are people embedded in place that use different resources and different information, and we have to talk across disciplines because, say, we get a vaccine. 7.5 billion people need that vaccine. So suddenly, you as a public health official have to talk to providers. How do we get that to them? You have to talk to manufacturers. How do we get enough of that manufactured? It's very hard to make vaccines. It's very expensive. How do we get that delivered with a cold chain? It's something you're going to learn about when we do the advocacy part of this class. How do we make sure that the vaccine stays cold? Then how do we train people to deliver it? Here, people have somewhat access to healthcare, as you learn, but again, it's that provider, right? But in some places, there's not a lot of health systems or public health systems in place. So then we will have to train community health workers to make sure that they get out the vaccines. And that's what happens when we do measles, mumps, rubella vaccines in less resourced countries. So and then we don't even want to talk about the vials and the needles and all those other kinds of things and the reporting, right? So that's epidemiology. And then we're tracking once people get the vaccine, what happens. Are there adverse effects? How effective is the vaccine? Because viruses can mutate, which is one of the reasons why it's so hard for us to get, we don't yet, a vaccine for HIV/AIDS because it mutated so much. So all of these things and all of these actors continuously communicate with each other, but they all have a different language. But they're all looking at trying to keep the individual and the wider community healthy. So you can be in public health and you can be a frontline provider. You can be someone who's a contact tracer, seeing where things are going, how the disease is progressing. You can also be somebody who's in health communication and you're trying to communicate what's the best method to deal with this, how do we make sure everyone's safe. You can also be, again, somebody who's just doing the basic science, so you're coming up with the vaccine, seeing what does or doesn't work, what treatments work. And then you can also be somebody who, like Dr. Fauci, who is also doing policy. So they're speaking to Congress, saying what we need for the future to attack this disease, what we need to do to make sure that we flatten the curve so that we don't overwhelm the healthcare system because the epidemiologists tell us this, right? So when you see people talking to Congress, talking to policymakers, they are scientists, but they are fed information and they have information in a multidisciplinary approach, which is what public health really is, from lots of different players speaking across lots of different fields that help them come up with this policy and advocate for the policy to advocate for everybody's health. So that is why you need to do case studies, so that you get a dabble or a little bit of expertise in each of these areas through your case studies. You get used to working with people who have a different approach, and you're more prepared to go out there and work in public health and make the community healthier.